Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 73. RNA is nothing but the random questions in neurology and neurosurgery with answers by Dr. K Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. In this series, the question that I am addressing is, what are the features of Aicardi syndrome? Aicardi syndrome is a rare congenital neurodevelopmental disorder that is characterized by a classical triad: corpus callosum agenesis or dysgenesis, infantile spasms, chorioretinal lacunae, distinctive retinal lesions seen on ophthalmic examination. So this is the triad: the agenesis of corpus callosum or dysgenesis, infantile spasms, epileptic seizure, and chorioretinal lacunae. It almost exclusively affects the females it is thought to result as a mutation on the X chromosome. Usually lethal in males, they have an extra X chromosome. And the clinical features are infantile spasms beginning in early infancy and developmental delay, intellectual disability, hypotonia or spasticity, and refractory epilepsy. The brain abnormalities that are seen are partial or complete agenesis of the corpus callosum, cortical malformations, polymicrogyria or heterotopia, intracranial cysts, ventriculomegaly, and the eye findings are chorioretinal lacunae, highly characteristic, and optic nerve abnormalities, microphthalmia in some patients. The skeletal features are also seen like vertebral and rib anomalies and scoliosis. Diagnosis is based mainly on the clinical features, and MRI brain shows corpus callosum abnormalities and the associated malformations can be seen very well. Detailed ophthalmic examination demonstrate the chorioretinal lacunae. EEG often shows multifocal epileptiform activity and may reveal asymmetrical hypsarrhythmia. There is no proper treatment for this, or there is no cure. The management is just supportive. Anti-seizure medications can be given. Hormonal therapy for infantile spasms like ACTH, corticosteroids, physiotherapy, occupational therapy and speech therapy, education and developmental support. What is the prognosis of this? It varies widely. Most patients have significant developmental impairment. Seizures are often very difficult to control in these cases, and some individuals survive into adulthood with varying degrees of disability. When an infant girl presents with infantile spasms, agenesis of the corpus callosum or dysgenesis, and the characteristic retinal lacunae, I think Aicardi syndrome should be strongly suspected. Now, who is this Aicardi? John Aicardi. He was a renowned French pediatric neurologist who made major contributions to the understanding of childhood neurological disorders. He worked extensively in pediatric neurology in France and later in UK. He is recognized internationally as one of the founders of the modern pediatric neurology and authored the influential, the most lovely textbook on diseases of the nervous system in childhood, a standard reference in pediatric neurology. A lovely book indeed. And in 1965, John Aicardi described the syndrome now bearing his name, characterized by agenesis of the corpus callosum, infantile spasms, and chorioretinal lacunae. John Aicardi is remembered as a pioneer who greatly advanced the diagnosis and classification of pediatric neurological diseases, especially childhood epilepsies, developmental brain malformations, and neurogenetic disorders. His work continues to influence pediatric neurology worldwide. That's indeed about Aicardi syndrome. Thank you very much.